The UK decision banning puberty blockers for children followed an independent review, citing safety concerns and limited research on long-term effects. The National Health Service concluded there is not enough evidence to support the safety or clinical effectiveness of puberty-suppressing hormones to make the treatment routinely available at this time. Former UK Prime Minister Liz Truss applauding the ban.
I'm delighted that the health service is now saying that no under 18s can be prescribed these drugs.
Here in the U.S., a recent study shows nearly 20% of all people identifying as transgender are aged 13 to 17. That's close to 300,000. The number of kids known to be on puberty blockers or cross-sex hormones has more than doubled in 4 years, from close to 2,400 in 2017 to more than 5,000 in 2021. Sarah Parshall-Perry of the Heritage Foundation blames gender ideology for fueling the rise.
We're seeing this increase because young people are vulnerable to the impacts of peer pressure, social media, cultural elites, and again, what they are hearing from their commander-in-chief and the individuals in positions of power in this country.
Effects are linked to poor mental health among children struggling with gender confusion. Research also found that 34% of trans youth have experienced a decline in mental health while taking the drugs. Physicians say major concerns include risk of sterility, lifelong dependence on medication, and anguish of regret. Nathaniel Blake of the Ethics and Public Policy Center.
They are experimenting on children with no real understanding of what they're doing. With regard to sterility, that is a real problem, and that is inevitable for some of these treatment pathways.
More than 20 Republican-led states have adopted laws restricting medical intervention for children with gender dysphoria.
We've seen many of these bans enacted at the state level, 23 bans for procedures, cross-sex hormones, and puberty blockers for minors under the age of 18. My hope now is that this will encourage more states to pass bans for these procedures under the age of 18 in their states.
Back in Europe, more countries such as Norway, Finland, and Sweden are following the UK's lead. And Blake is hoping that trend soon includes the US.
I think it will happen. I don't think that it will be quite the same as in the UK, but I think all it may take will be one or two big lawsuits winning. And if there are major damages awarded to some of the people who have been hurt by gender transition, that might break the industry, which has simply been able to profit off of injuring people and has not yet been held accountable for that.
Charlene, CBN